you like to say anything about admissions with young people in relation to smoking?
Yes, well, I'll make a few broad comments on smoking if I can. So 78 years ago, Parliament passed the National Health Service Act, which led to the formation of the NHS on the 5th of July 1948. In my view, the legislation that you're considering here today is one of the most important, if not the most important pieces of legislation since the passage of that Act 76 years ago. Why? Because of the extraordinary impact that smoking has upon the health of the nation and, of course, directly upon the NHS. So to put that in a bit more context for you, you've heard some of this already, but maybe some more detail. Smoking is associated or causes over 100 individual conditions that are managed and treated within the NHS. It impacts the NHS at all levels. Almost every minute of every day there is a hospital admission related to smoking, over 100 GP appointments every hour for smoking-related disease, 400,000 admissions a year related or associated to smoking. You've heard the Chief Medical Officers briefly talk about the impact on specific diseases. Again, lung cancer is the one that everybody knows around. 80% of lung cancers are caused by smoking. This bill has the opportunity to transform lung cancer from a common disease into a relatively rare disease, one that clinicians of the future will not see in any way as commonly as clinicians of my generation. But it's not just lung cancer. You've heard about the impact on cardiovascular disease. Clearly COPD, which again would become a rare disease for clinicians and the patients of the future, but also an early impact on diseases that affect young people. So asthma, a disease not caused by smoking, but a condition exacerbated by smoking. We see admissions, particularly over the months where asthma is worse, where there are respiratory infections which are no doubt exacerbated by smoking. And in mental health, smoking doubles the risk of developing depression. More than 1 in 2 people with severe mental health conditions smoke, and life expectancy in those with mental health is reduced because of smoking.